So when you go to your doctor, let's just go through just a little overview of what your doctor will do if you go to them and say you've got heavy menstrual bleeding. So first of all, your doctor needs to understand what is the pattern of your bleeding. When you say you've got heavy menstrual bleeding, what do you mean? How many pads or tampons are you using? How often are you changing them? Then when did this problem start? How long has it been going on for? How long does it last for? Okay, was this a problem that started when you started your periods, like when I said menarche? Or is it something that, I have had normal periods for 5 years and all of a sudden my periods have changed? So this is the kind of information your doctor will want to get from you. And they'll also want to know, because we said heavy menstrual bleeding is significant bleeding or menstrual bleeding that affects a woman's quality of life. So they want to know, how is this affecting you? And this is the time to say, because of this bleeding, it's so heavy, I'm having to take time off work. It's embarrassing, I'm flooding the chairs at work, or I'm flooding the bed sheets or the mattress, or or in school. These are the things that your doctor wants to understand clearly, how just the impact that it's having on your activities. So please be open about the any effects that you're experiencing. We would also want to know if you're having any other symptoms, for example, a vaginal discharge. We talked about PID. So is there vaginal discharge? Are you getting pain around your abdomen, or pain around your pelvis or tummy? Are you having problems passing urine? Is it stinging or burning when you go to pass urine? Are you experiencing accidents where you're leaking? Because we're looking at possible causes. So we're going to ask everything related to your genital area. Okay, so your doctor will ask those questions. Don't be surprised to hear about such questions. Your gynecological history, your doctor wants to know normally, what are your periods like? I always say to my ladies, please make sure that you're recording and have it in your app or in your diary, or write it somewhere. What's your menstrual flow? When was your last period? What we want our women to say to us when was your last menstrual period? Oh, hang on, let me just, and it's there. You put it on your phone or put it in a book somewhere. You've got it there. So keep track of those things. Keep track of any changes. So what's your period like normally? Have you had any gynecological procedures, operations? Have you had any treatments? Have you been pregnant before? Any terminations? Have you children during childbirth? Was it by vaginal birth or C-section? Were there any complications? This story. So we haven't even started with tests. So we want to know everything so that by the time we're thinking of the tests, we have a focus. We're looking in a particular direction. That's the help that all this information you're giving us will then provide. Sexual history. Very, very, very relevant. So this is not the time to be shy. This is your health, okay? Any sexual partners? When last did you have intercourse? Is there pain during intercourse? Have you had a sexually transmitted infection before? Was it treated? Do you use condoms during sex? What contraception do you use, and so on? Those are the kind of questions. Then, smears, your cervical smear history. Did I mention that? No. Cervical smear history is important. Have you had a cervical smear recently? Have you had your HPV vaccination? Those details. We'd also want to know about your general background. Now, this is just an overview. There's so many questions to ask, and if you want me to, I can do a separate video when we're looking at the history, taking the bits so that you're prepared when you go and sit with your doctor to have this discussion. General questions. How are you feeling generally? So outside of the bleeding, are you losing weight? Remember I talked about tiredness and fatigue. Are you feeling unduly tired? Before it's a couple of hours at work and you're exhausted, you want to go to sleep, you want to lie down. Are you getting breathless, more breathless than usual? You just walk 5 minutes, just walk to the coffee room or go up 2 flights of stairs and you're panting for breath, and you weren't doing that 3 months ago. Red flag. Okay, so general questions that your doctor would also ask. Any medical problems? Maybe do you have high blood pressure? Do you have other medical conditions? Family history. And your doctor will also ask about the standard things. Do you smoke? Do you take alcohol? Just so that we get a good picture of you, and we can then have an idea of where this problem is coming from. We've not gotten to the test yet. We're going to get there, but this is part of the workup, and this is why I want to get us away from, it's only scan that can answer the question. Other things are important. After the questions, your doctor should examine you. Examination can include examining of course, the general examination, but also examining your abdomen. So they want to have a feel of your tummy, look at your tummy. They might be able to detect the swelling. For example, if somebody has fibroids, or if you're having pain, that might give a clue as to what's going on. Then an internal examination. Don't forget to ask for a chaperone if you need one. an internal examination. They want to have a look at the vagina, have a look in the cervix, see if the cervix is tender or painful. If there are any changes, please go and check out my video on conditions that affect the cervix to understand what I'm talking about. And at the same time, when they're doing the internal, they can take some swabs to check for infections. So we've done the history, we've got the story, we've examined you. Next, we will look at tests, blood tests, pregnancy tests, full blood count, to check if you're anemic. We'll do that. Then, of course, an ultrasound scan. An ultrasound scan can tell us if there are fibroids present. Of course, that's important. But what I'm trying to get your head away from is, it must only be a scan. Apart from the scan, there are other things that they could do, because your scan could come back normal. So if it comes back normal, what next? Next would be perhaps refer you to your gynecologist, where you can have other tests like a hysterectomy. That's when a tube with a camera is put into the womb to have a look round at the womb. So it gives you better view than the scan, because you're actually looking into the womb itself. And in many cases, they can take a little piece of tissue called a biopsy that you can send off for tests, which will be useful. For example, looking for abnormal changes that might mean cancer and so on. So big range of tests that you can potentially have and that you should have if we're investigating for different causes of heavy menstrual bleeding. So I hope that's helpful to debunk that idea that you only need a scan to know the cause of heavy menstrual bleeding. Okay, next one is that heavy menstrual bleeding can only be treated with hysterectomy. That is a lie. Tell them, if anybody is trying to say that to you, that's not, or that you must have a hysterectomy to treat heavy menstrual bleeding. That's not true. The treatment depends on the cause. Now, but we've gone through the different possible causes. So if it's an infection, for example, it needs antibiotics. If it's fibroid, it needs different treatments. Medical options for treating fibroid, surgical options for treating fibroid, which can include removing the fibroid, that's the myomectomy, or depending on the woman's situation, it could be a hysterectomy, depending on the woman. But you also have non-invasive methods for treating fibroids, like uterine fibroid embolization, and different things that can be done. So the answer, because somebody is having heavy menstrual bleeding, is not straight to the operating theater to remove the womb. That's not true. Okay. Treatment. When doctors are considering treatment, we also look at your current situation in terms of children. So for a woman who does not have children, she's maybe in her early 20s or late 20s and has not started her family, you're not going to be, and this is a discussion that we'll have, nobody's going to bring first forward that, okay, let's have surgery or let's have an operation. Even in terms of medical treatments, you have hormonal and non-hormonal treatments. And for somebody who hasn't yet started their family, you're likely to be offered non-hormonal treatments in the first instance. So there's a wide range of discussion of options that you should have. And it all depends on your symptoms. It depends on your preference. It depends on, have you started or completed your family, and so on. So there is not one rule that somebody with heavy menstrual bleeding will end up with a hysterectomy. So that's one assumption I wanted to debunk. And lastly, we will look at this question, which is women with heavy menstrual bleeding can't have children. So I want to particularly debunk that. It's related to the fourth point, because they're saying that, well, because they're going to have treatment with hysterectomy, so they can't have kids. That's not true. Women with heavy menstrual bleeding can certainly go ahead to have children. The key thing is we're looking at the cause of the condition. Once we've identified the cause, in many cases it is treatable. So never assume. You have to sit with your doctor, whether it's your GP or your gynecologist, to thoroughly explore the symptoms, do the test, so that we can work out the right treatment.